Currently in the United States, our healthcare system spends 75% of healthcare dollars on treating 4 major chronic diseases: obesity, diabetes, heart disease, and cancer. In many of those cases, those are preventable diseases. They're caused by poor diet, lack of exercise, and smoking. The U.S. healthcare system is really good at treating diseases. So once people get sick, we can treat the disease, we can care for you, we can keep you alive. But the U.S. healthcare system doesn't do as good of a job at actually preventing those diseases from happening. So actually addressing things like poor diet, exercise, getting physical activity. So what does healthcare reform do towards trying to shift the U.S. healthcare system towards preventing disease versus treating disease? So there's a couple of things. One, right now, Medicare recipients, it actually kicked in 2011, Medicare recipients can go to the doctor for preventative care. There's no deductible, there's no copay. So when you go to the doctor, you aren't paying that $10 or $25 to actually see the doctor. It's free at the point of service. This actually will kick in or slowly kick in over the next few years for those with private insurance. So eventually, every American will be able to go see their primary care doctor and not have to pay those copays or that cost sharing. Another thing that will happen under health reform is there are incentives for employers to either create a wellness program for their employees or improve the wellness program they already have in effect. So there are federal dollars that employers, private employers can use to really enhance their employee wellness programs. In our Medicare and Medicaid programs, there will be behavior modification programs, and they provide incentives for Medicare or Medicaid recipients to quit smoking, lose weight, things that you can do to stay healthy. And there will be the incentives for those recipients to actually do those preventative items. There is also a new model of care in health reform that initially will start out in the Medicare program and Medicaid, and it's called a patient-centered medical home. And it really is trying to shift the idea of medical care happening in a primary care setting. So what a patient-centered medical home does is the patient is the center of that preventative care, and it provides for a team of professionals, so physicians, nurses, nurse practitioners, dietitians, social workers, all working to provide preventative care for that patient. The idea of this patient-centered medical home is that it coordinates the care of patients and keeps them from entering the hospitals. Finally, there will be grants from the federal government to provide walking trails, to help people in that community quit smoking, to eat better, healthier foods. Communities can decide what are things that we can do as a community to remain healthier, to prevent disease from actually happening. Ultimately, if we want to reduce healthcare costs in this country, we have to shift our healthcare system from treating disease to actually preventing disease. There are provisions in the Affordable Care Act that work towards shifting our system to focusing on prevention versus treatment of disease. This is vitally important to actually bring down the costs of healthcare in America.